They start at my toes and go clear to my head. They're always looking for something.
I feel safe and secure here.
They're here for me 24 hours a day.
Going in every hour, making sure that they have what they need.
You can walk in, you just look at their color, you talk to them, you can notice their breathing as you assess every situation.
In as little as an hour, a patient could actually have a significant change that would require acute intervention.
One time when I was rounding on my patient for hourly rounds, the daughter had actually tried to get the patient up and he had started to fall. The door was closed, so she wasn't able to yell for help, and I came in and I was able to help get him back into the bed.
It's very important to check in on our patients frequently, just because you never know what's going on until you see that patient.
We're the ones that communicate that to the physicians.
I've walked into rooms multiple times where patients who are completely with it oriented previously have had a change in mental status. They're confused at this point.
We've all had moments where we've walked into a patient room and the situation was not what it was 20 minutes ago. Things can change so quickly with our patients.
It's more than just checking on my patients. It's making sure everything is absolutely ideal for them every hour.
By doing this purposeful hourly rounding, it's really just not an act of going in there every hour. It's really about connecting with that patient and their family. And it gives them a sense of hope and confidence. We're not just taking care of the patient, we're taking care of the whole family.
The first time you go in, you may not be able to engage as much as you'd like, but when you keep going back and back and back every single hour, those small little moments add up to a huge part on the patient's experience.
It can get very lonely back here, you know, and you think people have forgotten about you, and they haven't, and it's proof that they haven't, that they're here hourly.
We're going in, we're looking at their IVs, we're looking at their coloring, making sure that they get the medical care that's been prescribed to them, making sure that they're getting it in a safe and compassionate way. So they're doing all of those things as they walk in the door and as they're talking with their patients.
Okay, let me make sure everything is accessible. Your phone, water, and your call light.
Okay, that sounds good.
Okay, is there anything else I can bring you?
I see the doctors at round time, and they're great, but the nurses are the ones that I interact with. They're my contact with this hospital.
We're also the eyes for the doctor because they cannot be with the patient all throughout the day. We're the person that's with the patient. We see subtle changes.
The doctor, he stops in once a day. The nurses is probably 25 times a day.
I think it's always important to have a connection with the patient because you want to know where they come from. You want to know what they've been through and how that shift that you're on as that nurse, what you can do to make a difference in their care or their life.
I've had Crohn's disease for about 35 years now, and I had an operation on March 11th of 2016. It doesn't matter how you do it in your own way, but just engage with that patient. Because if you do that, it makes a heck of a difference, and the patient's going to remember that for the rest of his or her life.
A lot of times they're scared already, and just coming in just to say hello, do you need anything, or is there anything I can get you, it means a lot to the patients.
How are you doing?
I'm doing great.
Are you having any pain right now?
No.
No?
The smile is so, so important because when somebody smiles at you, you feel that they care about you and that you're being cared for in a perfect way.
That's when you know you did a good job.
The nurse on the front lines is the person who develops that relationship. More time to do it, more exposure, and more intimate with the patients than their physicians are or anybody else in the hospital. We count on nurses to do this.
And I really want you to embrace this opportunity to really connect with our patients and really get back into why you went into nursing.
For me, nursing is all about having a heart.
I've always had a passion for taking care of patients.
I can make them feel confident in my care.
I could be a teacher, a healer, a helper.
I love being with the patients. I love talking to them, talking to the families.
You just got to remember why you're here. Remember you're here for the right reason. You're helping people, and so don't forget that.
That's the high point of our days, is when we're able to be helping the patients, when we're able to be in there, rounding, seeing what their needs are, taking care of those needs.
When I put on my uniform and I walk in the door, I know I'm going to do a great job for my patients that day, and I know my coworkers are also coming to do the same thing.
I just wanted to say I'm so grateful to all of the nurses at the Cleveland Clinic and all of the caregivers that were involved with my case and will be involved with my case coming up.
The way you cared for him really touched me, and I'm proud to be a nurse at the Cleveland Clinic, and thank you for all that you do every day for every patient.
Nursing. Good morning, Pam. How are you? My name is Deanna. I'll be your nurse today. I just came in to do some hourly rounding. We hourly round on all of our patients just to make sure they're getting the most excellent care always. Are you having any pain right now?
No, not right now.
Okay, all right. Do you need to use the bathroom?
No, I'm good.
All right, well, you make sure you let me know if you need to go or if you're having any pain, and I will take care of that for you, okay? I see you have your incentive spirometer here. Have you been instructed on how to use it?
Yeah.
Okay, can you show me? Oh, good, good. Let it go all the way down. There you go. Try again. Very good, very good. And we use the incentive spirometer to help prevent pneumonia. When you're not up moving around, your lungs get kind of weak, so it helps expand your lungs, okay? All right. Would you like to be repositioned a little bit?
Yeah, I feel like I'm sliding down in the bed.
Okay, all right. I'm going to lower the head of your bed and let you scooch up just a little bit, okay? There you go. Your hips okay?
That's a lot better.
So you're more comfortable now?
Yes.
Okay. I'm going to tidy up your room and make sure you have everything you need, okay? All right. The doctor came in to visit you today?
Yeah.
Oh, good, good. And so we have a plan for your discharge and everything? Awesome.
Told me a lot of things.
That's great. Oh, you're so sweet. All right. Okay, so it looks like you have some fresh water. Do you need any coffee or anything?
No, but I would like to know how to order. I don't understand how to order anything.
Perfect. So this is your menu.
Okay.
You can order any of these items. You're on a regular diet, so you don't have any restrictions on your diet. These are the breakfast items, and then the lunch and dinner. You just use your phone, and I'll get that for you. So we turn it on, and dial 8328, and they'll ask you your room number, which is 2208, and then you'll just tell them what you want.
Oh, perfect. Thank
and then
you.
You hang it up, and I'll leave that right there for you. So I'll let you look over that.
Okay.
Looks like you have everything you need. Is there anything else I can do for you?
No, you've been very helpful. Thank you.
Thank you. You have, you let me know if you need anything, but somebody will be back to round on you in about an hour, okay?
I'll look forward to that.
All right. Thank you, Pam.